Do you have neck or back pain? Seen a provider and told all you need to do is exercise more? The more that you move, do you just hurt more? Do you find it not to be effective? Unfortunately, you're not alone. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with neck and back symptoms for decades, and I'm very familiar with the role of exercise, corrective exercise, stretches, physical therapy exercises in the recovery and treatment plan for my patients. So let's get started on this topic. It's very common for us to have patients come in and they just feel like all they need to do is exercise more. That's what they've been told by providers. That's what they've been told by friends and family. And unfortunately, academics all around the nation have written clinical practice guidelines where exercise is the primary, and primary means the first, the most important thing that needs to happen to make neck or back pain get better. If you can't even bend over to put your socks on, you're probably laughing at that. If you can't even look over your shoulder to drive safely in traffic, the thought of doing exercises makes you laugh, if not want to cry. So, is this really the case? Is this really true? Is exercise the primary, the most important part of recovery for neck or back pain? This is kind of a sacred cow for a lot of academic healthcare. Everybody recommends exercise. The reality is, if these recommendations are truly accurate, research studies that look at the results of patients that have gone through exercise treatment plans should show that these patients do get better. Recently, I was reviewing a large database of research that is summarized. It's the Cochrane Database. What they do is they take a look at studies all around the nation, all around the globe, and they pull them together, they look for common traits, and then they summarize them. And this database the Cochrane Database looked at exercise for acute, which means recent neck and back pain, and chronic neck and back pain. And I've got some notes with me here, and I just want to review them with you. They found ultimately at the end that exercise does not consistently bring about changes in pain or function in adults with chronic pain. Wow, what a surprise. Unless you were somebody with chronic pain that is overexercised and discovered that for yourself. These clinical practice guidelines and systematic reviews really tell us that all other forms of therapy, like hands-on therapy or acupuncture, things like that, should be put onto the side and the focus should be on exercise. But it didn't bear out in these when they looked at all these research studies. In fact, when they looked at it in a little more detail with acute, that means recent onset low back pain with the Cochrane review, there was a minimal effect on acute, that means recent low back pain. I believe the range was between 1% to 2%. For chronic low back pain, there was no difference between exercise compared to other forms of treatment. So you could exercise for an hour or go have a very brief other form of treatment and possibly get the exact same results. Patients have been noticing that for years. What about extremities? Now, this video is not about extremities, but we'll just comment them on there. There was a study that was done in Denmark where they looked at patients that had knee pain, and 8 weeks of exercise compared to 4 fake injections where they just injected saline into the joints of the knee. They're called placebo injections. No difference. 4 fake injections, 8 weeks of exercise. No difference. So exercise does not consistently bring about a change in pain or physical function in adults with chronic pain. Another place that we see this as an issue is when somebody is injured, whether it's a motor vehicle crash or whether they're injured at work. At some point, oftentimes the patient will have what's called an independent medical exam, where another doctor that is hired by the payer examines them. And it's so frequent. I see it after 20 plus years in practice. You don't need any more medications. You don't need any more conservative care. You don't need any more therapy. You just need to exercise more. Those are guideline discordant recommendations by doctors like that, and it leaves patients feeling frustrated. So let's take a step back and let's put this into perspective. In this video, am I saying that exercise is bad? Absolutely not. It is very important. However, as the primary, the most important, the first thing to start off with, it is not. In fact, if you have a nonspecific diagnosis, just throwing exercises at a nonspecific diagnosis, meaning you got a diagnosis of back pain, that's not a diagnosis, that's a symptom. The issue is in the tissues. If you can't have a provider tell you what tissue or tissues are dysfunctional, painful, damaged, injured, or giving you symptoms, your likelihood of getting better is very low. An imprecise diagnosis oftentimes leads to a very, very bad recovery. The most important thing for you is to get a more appropriate diagnosis. Now, once the pain levels are reduced, range of motion is starting to improve, exercising around the joint, whether it's the neck or the lower back, and improving the core strength and stability in that area, that is beneficial. In fact, the research shows that a combination of chiropractic care with exercise therapy is a very, very strong and powerful combination. However, having painful joints or painful discs in your neck and back and just exercising around them, you might not get much of a recovery at all. So I hope you found this video helpful. I hope that you understand the implications of what I'm telling you, that exercise is important, just not as a primary source and the only source of treatment. You have a lot of videos to pick from. I'm honored that you chose this one to listen to, and I wish you all the best on your healthcare journey. And until we meet again, be blessed.